Great. All right. Welcome, everybody. Good afternoon. We're happy to have you here at our Systematic Reviews and Introduction workshop. My name is Daisy De La Rosa. I'm an Information and Instruction Services Librarian at the FIU Medical Library. And I'm joined today by my colleagues Ramses Marsili and Joanna Fernandez, who are both librarians at the FIU Libraries. And just to kind of set some expectations for this workshop, we're not really teaching how to do systematic reviews or how to do the searching. It's really like a 30,000-foot view, providing you with an introduction or an overview of what they are and what the process looks like. So this is part of our Work Smart Library workshops. As you can see here, we've kind of already done the majority of them for the spring term. Our last session is next week, which is AI tools for library research. But of course, the recordings for all of these workshops are on the YouTube channels for the medical library and FIU libraries as well, if you weren't able to make them. So a little bit of housekeeping. I will repost again into the chat at some point a handout with links to several of the resources that we're pointing to, as well as the PDF of the slides. We will do our best to pause for questions throughout the session, but feel free to put them into the chat as you think of them. And the recording of the session will be available on our YouTube channels, both FIU Libraries and the Medical Library. So we wanted to start with a quick poll just to see where everybody is as far as their experience with systematic reviews. So what brings you to today's session? I'm going to go ahead and launch that from Zoom. And we'll just take a couple seconds there. We just want to see where everybody is. Okay. All right, great. Okay, so it looks like everyone that's on the call so far has responded. So I'm going to go ahead and end the poll and share the results. So hopefully everybody can see that. So that's good. We have some people that are planning to work on one and they want to learn more. So this is a great session for you to kind of see what to expect, so you can plan ahead. And then we have someone who has already worked on systematic review. So hopefully this will be a nice refresher for you. So thank you so much for joining us and for participating. All right, great. Okay, so here is an overview of what we would like to cover in the workshop. Define what a systematic review is, what their characteristics are, why they're so important, what you should consider before doing a systematic review and why, and that there are other types of reviews or evidence syntheses that you can consider depending on, the time that you have available, if you have a team, and of course the research question. We'll talk about the standards and guidelines that are available that help you in conducting systematic reviews, providing you with guidelines and instructions, and also how to report what you do in that systematic review. We will provide a basic overview of the entire process, going through each step. And we'll spend a little bit more time on the searching part of the process because we are librarians and that is our expertise. The type of searching that is required for systematic reviews is exhaustive searching, and that does take some time to learn. So we just wanted to kind of expose you to what that looks like and what you can expect. And we will go over some resources for each step of the systematic review process. So what is a systematic review? So right here on the slide, we have a puzzle of a Q elephant. So many times systematic reviews are compared to puzzles, where you want to think of the individual pieces of the puzzle as individual studies. And the process of putting the puzzle together is that systematic review process. So at the end of that process, all the puzzle pieces have been put together and you can see the bigger picture of what the evidence is saying, of what the studies are saying. So that's a nice metaphor for that. So we do have a couple definitions here. The first one is from the Cochrane Group. They are the leading authoritative organization that produces systematic reviews, but they also provide a lot of guidance and resources to help others conduct systematic reviews. So if we look at their definition, a systematic review attempts to identify, so that's search and find, appraise, right, evaluate for quality, and synthesize, put all together, the empirical evidence that meets pre-specified eligibility criteria you've decided on before you even start the project, to answer a very specific research question. Researchers conducting systematic reviews use explicit systematic methods that are selected with a view at minimizing bias to produce more reliable findings to inform decision making. And we see here the GIF on the right from Cochrane, where the magnet is kind of extracting all the relevant studies that are at different levels of evidence, and they put it through the funnel, right? That systematic review process, and it ends up in that funnel plot. We also wanted to include a definition from the Campbell collaboration. So this is another group that produces systematic reviews and evidence syntheses, but this is geared more towards the social sciences. But we'll see that the definition is very similar to Cochrane, right? Where a systematic review uses transparent procedures to find, evaluate, and synthesize the results of relevant research. The procedures are explicitly defined in advance, right? So we see that theme again of doing things before you even start making all these decisions. And we'll talk about a protocol in a little bit to ensure that the exercise is transparent and can be replicated with the goal of minimizing bias. The studies included in a review are screened for quality so that the findings of a large number of studies can be combined and ultimately that they can be reliable. So some characteristics of a systematic review, and again, this is coming from both Cochrane, which is geared towards more the health sciences, and as well as Campbell collaboration, which is geared towards the social sciences. A systematic review should have clear objectives with that predefined eligibility criteria, right, before you even start. This is your inclusion and exclusion criteria of the studies that you plan to review. It should have an explicit reproducible methodology, including a systematic search to identify all the studies that meet that predefined eligibility criteria. It's a reproducible methodology that someone, could follow and get the same results that you're getting. It includes an assessment of the validity of the included studies. It may have systematic coding or a synthesis of all the characteristics from the studies that you have included. And when it's possible, there will be a quantitative synthesis or a meta-analysis where you're able to statistically combine the data from the studies. So here's just another way of looking at systematic reviews. You want to think of it as a study of studies, right? It is a research methodology, just like any other study type. And the literature search is what provides you with the pool of potential subjects. So with any other studies, people might be your subject, right, that you're looking at. Well, for systematic reviews, the subjects are the studies themselves, right? And the quality of the systematic review is going to be dependent on the quality of the research that you have included, right? So even though you've done the systematic review perfectly, if the studies themselves are flawed, then that means that the results are also, flawed. And that's why you're doing the systematic review, right? Is to kind of parse that out and figure that out. And then each study that you do include, again, should be appraised for quality by the review team for that reason. So here's a visualization of a systematic review, right, where those little triangles are the individual studies. They go through the process of the systematic review, right, if they meet the inclusion criteria. And then at the end, you have your systematic review, your report, again, which kind of looks like a puzzle, as we mentioned earlier. And then the green arrows are kind of just a signal saying, okay, now once you've done this, it gets disseminated to others in that field, to any other stakeholders where that information is important to them to help them make decisions. So to help us further define systematic reviews, it's really important to distinguish them from narrative or literature reviews, which a lot of us do, whether it's part of a bigger project or it's a project within itself. But many times these get confused, but they are not the same thing. So here are some of the big differences. A systematic review requires a significant amount of time. It could be 12 months, 18 months, and we'll see why that is in a little bit. Whereas a literature review, it could take maybe a couple months, right? It's not as rigorous or comprehensive. A systematic review does require a team, whereas a literature review, you can do that by yourself. The systematic review's goal is to find and evaluate all the evidence that answers a specific question, whereas a lit review wants to provide an overview of a topic. A systematic review will have a protocol, right? These are the decisions that you've made in advance, and then you just follow that protocol, which results in that systematic review. The literature review doesn't really have a plan or a protocol. A systematic review has comprehensive, exhaustive searching, whereas a literature review may not be as comprehensive. It might be more of what we're used to, that natural searching where you put a couple keywords, you look at the search results, you change it, you pick a couple articles, right? That's more of the lit review, whereas a systematic review, it's a little bit different. Systematic review, your search should be reproducible, where you're reporting it, someone could copy and paste it and do the exact same thing. When you read a literature review, they don't really tell you how they found the articles or what they searched. A systematic review is going to retrieve a high number of results, hence why they take so long. Because they're trying to be comprehensive, a lit review is going to retrieve lower number of results because you're not being as comprehensive. A systematic review will provide you with reasons why certain studies were included or excluded, depending on that protocol. Whereas a literature review, if they're mentioning different studies, they don't really tell you why they included those or excluded some other ones. And then finally, a systematic review, all the studies must be assessed for quality or risk of bias, where a literature review may not consider the differences in the study quality of the ones that have been included. So very different projects, very different goals. And just quickly, because I love this little metaphor here, with the systematic reviews, you have kind of that needle in the haystack where you have a lot of stuff, a lot of articles, and you're trying to find those needles that meet a criteria. Whereas a literature review, you're kind of cherry picking. It's not really following any type of protocol. Okay. So systematic reviews are really important because they're considered the highest levels of evidence. This is usually an evidence pyramid used in the health sciences, but they're important because they help synthesize a large number of studies that are trying to answer the same question. And if they're done right, the methodology ensures that you've been comprehensive, that you're reproducible, and that you have minimal bias. So that makes the results that much more reliable and trustworthy. And that could be said for any discipline, not just anything in the health sciences. Ultimately, systematic reviews, because of this, help policymakers make decisions. They've saved practitioners time because someone's already done the work for you. They've gone and done a comprehensive search. They evaluated the studies for quality and they synthesized it. So that's why they're really important, but more so it's really important that they're done correctly. So with all that said, right, is a systematic review the right fit for your project? So the first thing is the research question. The research question should be something that's clear, that's specific. It's not really a general topic or problem of interest. That's where a literature review would be great for like a general topic. So here we have some examples of research questions that are a little bit more general in their descriptions. Just because we may have people on the call that are health sciences or non-health sciences. So any of these could work in any of those disciplines. So all of these have examples of questions. The general topic is the flu vaccine, right? So question type could be needs, basically what do people want? So an example is, what are the information needs of healthcare workers regarding vaccination for seasonal influenza? Again, very specific question asking about needs. Another question type, and this one is probably a lot of systematic reviews aim to answer this type of question: impact or effectiveness. What is the balance of benefit and harm of a given intervention? So what is the effectiveness of strategies to increase vaccination coverage among healthcare workers? What's the cost effectiveness of interventions that increase immunization coverage? Then you have process or explanation. Basically, you're asking, why does something work or why doesn't it? How does it work or not work? So some examples, again, related to this: what factors are associated with an uptake of vaccinations by healthcare workers? What factors are associated with inequities in vaccination among healthcare workers? If you're in the health sciences and you have a diagnostic question, if you're trying to see if a certain study or test is sensitive to diagnosing a certain condition, this would be in this realm, right? Process or an explanation. Does it work? How does it work? And then a couple other ones: correlation. You're trying to find out the relationship between phenomena. So how does influenza vaccine of healthcare workers vary with morbidity and mortality among the patients? Again, correlation doesn't necessarily indicate causation. Another big one is views and perspectives, where you're asking something regarding people's experiences. So an example is, what are the views and experiences of healthcare workers regarding vaccination for seasonal influenza? And then finally, service implementation. What is actually happening? What is known about the implementation and context of interventions to promote vaccination for seasonal influenza among healthcare workers? So again, the takeaway from this is that there are different question types, and that they must be specific. And the goal is to try to find studies that have answered this same question. So there are research question frameworks that can help you formulate these questions. So PICO is a big one in the health sciences. This mnemonic, the P, the I, the C, the O, they all stand for something. So the patient, the population, it's asking you, the researcher, to think about, okay, who are the patients or the population? What's their health condition? What's the primary health concern? The I is for intervention. What is that main intervention that you're considering? The comparison would be the main comparison intervention, although you may not always have a comparison. And then the O is the outcome. It's asking you to think about, okay, how are we measuring the success or not of this particular intervention in this group of people? Are you measuring improvements or the effect of this intervention? So here's an example, right? In middle-aged overweight women, that's our patient or our population, is the use of compression stockings. That's our intervention during long flights. Effective in preventing deep vein thrombosis. That's the outcome. We're trying to figure out if that intervention helps prevent that, compared to in-flight exercises, and that's our comparison. For the social sciences, we have SPICE. So here the setting, or the S, is the context of the question. It asks you for the perspective, right? Who are the users or the potential users? The intervention, very similar to PICO. What is being done for the users? Comparison, asking you to think about what the alternatives are. And then the evaluation, what measurement are they using to determine the intervention success? So here we have another question. In assisted living facilities, that's the S. That's the setting of the question. Do therapy dog visits, that's the intervention we're considering, as opposed to no therapy dog visits, the comparison. Reduce the feelings of loneliness. That's how we're evaluating if this particular intervention is successful. And then our perspective, or our people, our patients, population, is in older residents. And then finally, SPIDER. And again, there's more of these. These are just some that we're highlighting. SPIDER is good for qualitative research, mixed methods, right? Quantitative and qualitative. So the S is for sample. Who are the group of people you're studying? The phenomenon of interest, you could think of this as the intervention, if that's relevant. The design, what are the techniques used to gather qualitative data? So focus groups, intervention, interview, observation. The evaluation is, what is the outcome of that study? And then the research type, is it a phenomenology, ethnography, grounded theory, case study? So here we have an example for first-time mothers. That's our sample that we're interested in. Does antenatal education, that's the phenomenon of interest, positively affect their delivery experience, right? That's what we're evaluating. The design are through interviews and surveys, and the research type is qualitative. So when you're coming up with your question for a project like this, you want to try to find a framework that works for you and formulate it in this way, because it has to be specific. This will help you with your search, as we'll see later on. And you have to make sure that you're able to define all of these things. So there are other types of reviews. Systematic reviews are not the only option for evidence syntheses. The research question will help you determine which one's the most appropriate. So here we have a few examples. A scoping review. This is also another popular evidence synthesis. The question is usually broader, not always. The methodology is very similar to systematic reviews, but the goals are different. This is where the differentiation comes in between scoping and systematic reviews. The scoping review, first, systematic review is trying to answer a very specific question. You're trying to find all the studies that are doing that. Whereas a scoping review, the goal is to map out what the evidence looks like, right? Clarify any concepts when it comes to that question, identify any gaps, examine how the research is typically conducted. So a lot of times people will do a scoping review first to then help them identify what are the most important questions here, to then do a systematic review. So very different goals with the two of those projects. An umbrella review is when there's already been a lot of systematic reviews published on a question. So now you're going to do a systematic review of systematic reviews, where not individual studies are the subjects, but whereas systematic reviews are what you're reviewing. Then you have a meta-analysis. A meta-analysis is a systematic review, but it's when you're able to statistically combine the data from the studies that are included in that systematic review. That's not always possible because maybe the data or the studies themselves are not alike enough to each other. Sometimes you'll see where, let's say 10 studies are included and 8 of them could be included in a meta-analysis and the other 2 couldn't. because maybe they weren't as alike or didn't have enough data to do that. So a meta-analysis may not always be possible. Then you have a rapid review. Rapid reviews are meant to address questions that need quick decisions, like a public health concern, like COVID, for example. There was a lot of rapid reviews, but they do employ methodological shortcuts that can introduce bias into the systematic review. But it's important to note that rapid reviews are not just there when you don't have a lot of time. Like, let's say, well, I only have 3 months. Let me do a rapid review. Like, that's not a justification to do one. It has to be because the decision is needed quickly. So if you don't have a lot of time, then you can always consider another review type or a really good literature narrative review, which we've already talked about. And again, the goal with that one is to give you an overview of the topic. So there are many other reviews. A systematic review may not always be the right fit. Another thing to consider is that systematic reviews are conducted by teams. So you do need at least 3 people. This will help you divide the work because it is a lot of work. The tasks should be completed independently or blinded from each other by at least 2 people to minimize errors and bias. And an additional person can help resolve those ties between the 2 people. And you want to include a variety of expertise on the team. You want to have someone that is familiar with project management, with this type of methodology, a subject matter expertise, an information specialist or a librarian, as we are search experts, and then of course, a statistician. And then finally, the other big consideration is time. Systematic reviews do take a lot of time. As I mentioned before, they could take at the minimum, maybe a year. It could be 18 months. It could be sooner than that, but more often than not, it's going to be a long project. Preparing the protocol alone could take, a couple months as you make those decisions, putting a good search together. You have to screen all those search results, right? Which sometimes could be in the hundreds and the thousands. That could take time. Extracting data from the included studies, preparing the report. So it is a long-term project. And that's a big consideration when you're deciding if this is the right fit for you. So I'm going to pause just really briefly. Are there any questions so far? And while we wait for that, I'm going to go ahead and just pop the slides into the chat again and our handout. Hopefully everybody's able to access that. All right, so I'm going to move on. If you have any questions, feel free to put them into the chat. I'm going to talk a little bit about standards and guidelines that exist that will help you with conducting systematic reviews and how to report them. As we saw earlier, one of the big things or characteristics of systematic reviews is that they need to be reproducible. So you have to report all the things that you did, and there are guidelines to help you with that. So there are several organizations that have produced guidelines. They help you with planning your systematic review, so creating your protocol, how to report your systematic review protocol, how to conduct the systematic review, and then reporting and writing the manuscript after completing the systematic review. So there's guidance for all of these steps, which is really great. I'm going to pop out into the handout, which I just put into the chat. So first, on the handout, you'll see any tools to help you decide if a systematic review is the right fit. So this kind of goes into some of the things we spoke about time, a team, and the research question. There's some neat tools here where you can answer a couple questions and it'll suggest what review type you should do. And then in the standards and guidelines, you'll see links here to Cochrane, to the Institute of Medicine, to Joanna Briggs, right? So these are all health science related guidelines for systematic reviews. And then we also have links to ones that are non-health sciences. So Campbell Collaboration, the Epicenter for Social Policy, the Center for Evidence-Based Management is good for management and leadership. They have guidelines for environmental science, systematic reviews, and for education as well. So we recommend kind of coming in here, depending on your discipline, to see which guidelines are the best fit. So these guidelines kind of go through all the steps of the process. They explain what you should be doing. And then you have the reporting guidelines. So down here, this will tell you how to report the systematic review. What should you be reporting? What type of information, and how it should be reporting. And again, we have some here. Prismas usually can be used actually for any discipline, to be honest. It's not only health sciences, but Campbell Collaboration also has information on reporting standards, for environmental research, and then for policy as well. So I'll jump back in here, and just to show you what the Prisma looks like, what you can expect. And again, this is a reporting guideline, very different from the conducting guideline. This is after you do the systematic review, then this is how you report what you did. So it'll tell you like you should be reporting all of these things for your methods, like the eligibility criteria, the information sources, so the databases, your search strategy, your rationale for the systematic review, like where is that reported in the manuscript. And then here on the third column, or the fourth column, I should say, you put the page number where you've reported that. And then you could see here the rest of it, like how did you do your study selection? How did you extract the data? You know, how did you report any biases, right? So it's telling you what you have to report, and then you have to indicate where it's reported in the paper. And some journals may require a filled out Prisma checklist. So here we have a published example. We're going to be using this throughout the session to kind of highlight some of the things we're talking about in a real world example. So in this example, in their methods, we see that they used the JBI methodology. This is linked on our handout, to conduct the systematic review, and that they used Prisma to help them report it. Okay, so again, these are guidelines that exist that you should use. And when you are writing a manuscript, this is something that you should let the readers know, right? What guidelines you used to conduct it, and what did you use to report it? So here's a systematic review process, again, that visual. And we're going to go through these steps in a moment, but identifying the question is the most important step. Then you have to write the protocol or the plan, and then you basically follow that plan. You search for the studies, you sift through the studies, right? You're looking at studies that meet certain criteria, you extract the data, you assess their quality, you're combining the data statistically if it's possible, and then at the end, again, we have that completed puzzle, right? So here's an overview of those steps, and we're going to go into each of these individually. So the first step is the pre-review, right? So this is before you even decide to do a systematic review. We've already talked a little bit about this. Make sure you're assembling your team, that it's multidisciplinary, and that everybody knows what their roles are and what the expectations are going forward. The research question, again, the most important piece to the whole thing, because that will determine every other decision that you make. When you're formulating the research question, you want to already think, is there a gap in the evidence that this is going to fill? Are there enough studies to do a systematic review? Maybe you have a really great question, but there aren't just enough studies to do a systematic review, right? And you want to use one of those research question frameworks that we talked about. Another important part is searching for existing systematic reviews, right? You don't want to duplicate research that's already been done. So check for published systematic reviews as well as those that are in process, right? There's ways to search for protocols. And if you do find an existing systematic review, is it old, right? Does it need an update? Then that might be a reason to do it. Or can they be improved upon, right? Assess its quality, and maybe your team can do it better. Then the second step, after you have a really great research question, you have your team, you have enough time to do this, now you've got to do the protocol, right? And so here we have this little comic that, you know, the researcher's like, oh, how far did you get? Well, I've got the conclusions. I just have to write the protocol. You want to make sure that you are not, you know, introducing bias that throughout the process because you didn't have a protocol, right? You want to make sure you have a plan that you follow, that it's transparent, because if you don't, throughout the process, you can change what you're doing, and that's going to introduce bias into that. So the protocol is essential for that reason. I see that we have a question here. Okay, so what is the minimum amount of studies that need to be included for a systematic review? That's a great question. I don't know if there is a minimum per se, because it's going to depend on what is available on that particular research question. You know, depending on the topic, you could expect to see, you know, 40 to 50 minimum at the end of all that. You could see 10. I've seen 3 and I've seen 0 actually. So, and what's the value of one with 0? Is it because you're trying to say that there aren't enough high quality studies? Are you trying to say that there isn't enough to do one and that more needs to be done to research this? So I know it's not a really great answer to that, but it's gonna depend. I mean, but I've seen a range. I've seen 7 at the end of the whole process. I've seen 10, I've seen 100 and something. So I think it does depend on the research question, and what the evidence is out there. So sometimes doing a scoping review first to kind of see what's out there might help you make that decision if there is enough to do. But I have seen a few that have 0. So yeah, hopefully that helps give you some clarity. So developing a protocol, and if it doesn't, let me know, and I'm happy to talk about it some more. So about the protocol is your plan, your blueprint for the entire systematic review project. You have to do it before you begin in order for you to minimize that bias. And it helps you make decisions for the project in advance. It helps keep your team on track and anticipate any parts of the process, know what tools and software you will be using. Ensure the transparency and minimize the potential bias, as I already mentioned. And if it's registered, it can help avoid the duplication of research efforts. So again, on the handout, we do have links for different guidelines on how to develop the protocol. So the protocol is going to include the rationale for review. Why are you doing the review, right? What is it adding to the existing body of literature? The review question, the PICO or SPICE, right? Any of those other frameworks that you're using. The inclusion and exclusion criteria for the studies you plan to include. So here are some common inclusion-exclusion criteria. Date, although we do caution against that. You should have a really good reason if you are limiting the date in your systematic review, right? And it could have been that maybe the therapy or the intervention you're looking at, didn't really exist until, 10 years ago. Okay, then it makes sense to have that limit. But if not, then you shouldn't have that limit. You want to be comprehensive. Some other criteria are the exposure or intervention of interest, right? Do the studies have that same intervention? Geographic location is another one that you should be careful with. Language as well, because that could introduce bias if you're only looking at a certain geographic location or only things that are published in English. The participants, right? What's their age? Is there, should any be included or excluded based on that? Their health conditions, where they live. Peer review, we've seen that a couple times. Not every database has that limiter. So as far as searching, it's very difficult to limit to peer review, but also you want to include all the studies, whether they've been peer reviewed or not, published or not, so that you're very comprehensive in what you're doing. What are the reported outcomes that you're looking for? What's the setting, the study design, right? Are you only looking at a certain study type, like randomized control trials, for example? And then type of publication, sometimes you'll see people are only looking at published articles. They might exclude review articles or letters to the editor. But that's something, again, to be careful for, because some of those types of papers could lead you to additional papers or studies. So those with the asterisks are the ones that you got to be a little bit more careful with. But these are all things you have to decide in advance before you start in the protocol. Information sources, so that's the databases you're going to search, the search strategy, how you plan to manage the data, right? Your references, any of the data that you extract from the studies, how you plan to do your selection process, your screening, how you plan to extract the data, any tools that you're going to use to assess the quality of the study, how the data will be synthesized. So all of these things, which is basically the entire project, are things you have to think about before you even begin. And then how you plan to disseminate, right? Are you going to publish in a specific journal? Do they accept systematic reviews, right? These are things you should know in advance. So we do recommend to register your protocol. Some journals actually may even require this. Registering the protocol helps you be adherent to the protocol, which will help avoid bias. The published results that are in the systematic review then can be compared to that protocol registered. And this again will help make sure that you've been transparent and that reduces bias, right? The protocol should be of high quality, right? So it should have, everything kind of fleshed out as much as possible and should be registered early in the process. And then other researchers can access your registered posted protocol. So this again, make sure that other people are not duplicating, research that's already being done. It allows you to search for other registered protocols on the same topic or question. And then Prospero is one of these protocol registries. They want the registration of the protocol to be done before the data extraction. So a lot of things to consider with the protocol. You can make changes to the protocol, but you do need to record what those are and why they were changed. And some journals can also publish systematic review protocols, and we'll see that in our example in just a moment. So sometimes you get two publications out of this. Sometimes people publish their protocol and then they publish the actual systematic review. So here we have that published example again, and they let us know that they created a protocol and that they published it in a journal and that they also registered it with Prospero, and there's that registry number. And again, some journals do require this. Here's a snapshot of the Prospero protocol that they registered. And then this group also published their protocol in a journal. So again, they got two publications out of this. Before I move on to and turn this over to Ramses for the search, I do want to mention one more time the handout. As far as the protocols, that we do have resources here on how to develop a protocol and then the different repositories. So Prospero is for systematic reviews, but there's also the Open Science Framework, and there's even a database for systematic reviews for education where you can post your protocol. So now I'm going to go ahead and turn it over to Ramses.
Thank you, Daisy. So wait, let me start my own. Aha. So now we move on to the search process of the systematic review. So as Daisy was saying earlier, the systematic reviews, oops, sorry. Systematic reviews require a thorough, objective, and reproducible search of a range of sources. Now, the reason we've highlighted those terms is I'm going to, define them a little later on, but they must meet all those requirements. So this is a major factor that distinguishes the systematic reviews from traditional narrative reviews. And those help to minimize bias and achieve more reliable estimates of effects of uncertainties. According to the Joanna Briggs Institute, the aim of a systematic review is to identify all relevant studies with an emphasis in all. So you're casting a very, very wide net. And then through the screening process, then you'll get, out of the net, all the things you don't need, and then, keep what you want. Whether these studies are published or not on any given topic. So searching should be based on the principle of comprehensiveness with the widest reasonable collection of information sources that are considered appropriate for this review. So now to get into some of these definitions, by thorough, we mean you'll be searching in multiple databases. You will use a variety of keywords and text words, and you will combine this with subject headings while also using supplementary searching. So once again, this may bring up more questions. We'll go into all of those, what each one of those bullet points means in a little bit. By objective, we mean that we're going to use search terms that include variations in terminology, and we're going to avoid bias in term selection. So this is just one of the few ways in which you aim to avoid bias in the process of doing a systematic review. And it has to be reproducible, which means you will document all search details. You will include which database or which platform you get this information from. You'll record how the search strategy was executed, and you also provide a date that all searches were run. By the way, all searches should be run on the same day. So all of these things need to be documented, carefully documented, and to make your search more reproducible. Now, as far as the research question and eligibility criteria, this will determine which information sources and which databases to search. And it also informs your search strategy, your concepts to search, keywords and synonyms to use, and subject heading. So what kind of databases are we looking for, or where do we search? Do you have an incredible variety of choice, and it's really all depends on what your subject is. If you're looking at, in the health sciences, then you have, Medline, Embase, Cochrane, CINAHL, Sports Discus, PsycInfo, Pedro for physical therapy. For non-health related sciences, you could always look at, ERIC for education source, Compendex for engineering, Applied Science and Technology Source Ultimate. You have Business Source Complete. You have, ABI Inform, collection for business. So, you do have quite a wide variety of databases to look for. As far as, multidisciplinary databases, you could always look through Scopus or Web of Sciences. We have regional databases like, LILAC, Cielo, and African Index Medicus. And you're also encouraged to look through great literature. So great literature is any literature that you cannot find, directly in databases, or that may not be your, typical academic articles. So you can look at clinicaltrials.gov. So you can look through government documents. You can look at World Health Organization trials registry platform. You can look at thesis and dissertations. So anything that may not be your typical, academic article based or academic journal based, those count as your great literature, and you're encouraged to look through them. Now, next, I'm going to show you something which is meant to be just maybe slightly a little bit shocking, but the reason I'm doing it is because eventually we will get to, or you will get to build something that looks exactly like this, and we'll take all of the, mix and, the myth and the complexness out of it. So this is a search string. This is a search string for the Embase database. I just kind of want to, look at it for a second and explore a few things. So for example, I want to, call your attention to this, the EXP, and just look at, all the times the word or is in there, look at all the quotation marks, or at the end is TIABKW, just means, title, abstract, and keyword. And as you can see, there's 4 different subjects here. We have, diet, intestine flora, obesity, and adolescence. What do these things mean? What is, how does this relate? What is this? Don't worry about it. We are going to build one of these. You'll be able to do this, no problem at all. It's just part of the, systematic review searching steps. Okay, so how do we start with the searching steps? We have identify, then harvest, create, translate, run, export, and remove. First of all, we identify the main concepts, and those comes from the research question. So we'll just do it everything little by little. After that, we will harvest the terms based on the main concepts. We will create a search strategy for just one database, and then we'll translate it to other databases. It sounds more complicated than it really is. Then you run all your searches, make sure you do it on the same day, export your citations, and once you have, all of your citations exported, then you remove the duplicates. Please remember to always keep notes and documents, and, document every single step in this process. All right, so let's go to the first step, identify. How do we identify our main concepts from the research question? Well, as Daisy was talking earlier, we do have the sort of, formulas or, mnemonic devices to do this. We have, PICO, which stands for population, or patient or problem, intervention, comparison, or an outcome. We also have, she was talking about spider, spice. It just depends on, well, different subject matters tend to lend itself better to different mnemonic or ways in which to identify the key concepts, but these are some of the main ones. So let's look at one. Let's look at an actual systematic review and the search question. So what is the impact of diet and physical activity on the gut microbiome for the treatment of overweight or obesity in children and adolescents? So if we take a look at this, we'll see that okay, the key concepts, you have your population. In this case, you have, so we'll look at population in a two-pronged approach. We have overweight and obese, and then we have children and adolescents. Then you have your intervention, in which case is diet and exercise, and the outcome is going to be the effect on the gut microbiome. So there's no control in this study. So we just have the population, intervention, and outcome. So this is one of those PIO formulas. So that's how we identify all of our key concepts. Next, we move on to harvest. So we're going to harvest your terms, and then we're going to create two lists for each one of your concepts. Okay, so this is part of the formula. We're creating two lists. We're creating one of natural language, which is comprised of your own keywords. You could use, to be found in the title, abstract, author keywords. And then you have your control vocabulary, which are proprietary to each database. So why do we do this? Why do we use two different sets of language, natural and control? It is because when you're doing a search, since you have to be very, very thorough, let's just say this is an actual result that was brought up from a search using both control and natural vocabulary on this topic. What happens is, for example, the natural language that I used is language that's going to look through the title and it's going to look through the abstract of the article. So this is where that is coming from. This is where the article gets drawn from the database. Using the natural language, it found some of the keywords that I had created, either in the title or in the abstract. However, the databases have their own control language, in which they use in their major subjects. So I also, some of the major subjects that I use, I was able to draw to extract the article through the search. In this case, I was lucky, and I was able to draw this using both the natural language or control vocabulary. But in case you miss one or the other, then this gives you the best chance at drawing, the most amount of results possible. So as far as finding your terms for your natural language, you could use, repeat any control language terms in your natural language keyword search. You could use synonyms. You could use different, spelling variations. You could use the plural and singular of, any terms. You could use, acronyms, as well as spelling out the phrase. So if you have, post-traumatic stress disorder, you should also use PTSD. So remember, you're casting a very wide net, and you can use narrower or broader terms. A helpful tip might be to find like 3 or 5 studies that meet your inclusion criteria and gather the terms either from the title, abstract, author keywords, and then look up each of these in the database as you plan to search, and then to begin your control vocabulary terms as well. So don't be afraid to borrow from other articles to start building your keywords and control vocabulary. So you can identify different searching background information, or you can use an AI tool. Sometimes such as ChatGPT. I've used it. Just please give me a synonym for gut microbiome, and you'll be surprised. So here we are. Now, as far as, so now I'm going to hand it over to Joanna, who's going to go a little bit more into finding control vocabulary. So let me stop sharing.
Awesome. Thank you, Ramses.
You're welcome.
So here we go. Let's explore a little bit more about the control vocabularies. They are proprietary, as Ramses mentioned, to each one of the databases. So we're looking at a reference product, a thesaurus, like a specific manual where each one of these databases is going to label how each concept will be used and the right term for you to identify all the articles that are going to be organized under that category. So for example, Embase has M3 and CINAHL its own CINAHL subject headings. ERIC and PsycInfo have their own thesaurus, and Medline has the map term to subject heading, which is an option that you can click on. As well as PubMed has its own mesh database. The whole thing, the point is to know that there is no like a one control vocabulary for every single platform. You have to investigate and research how is your vocabulary going to be labeled according to each one of the databases. And I'll quickly switch to the browser to show you how we can do that in PubMed, right? So once we are in the platform, it's good to go to the National Library of Medicine's mesh terms, and you do that by clicking on the header and then switching the list to search only the mesh terms. So this way, you are going to be able to explore how is the term that I'm looking for labeled within PubMed. So for example, if I am looking for the gut microbiome, the research result will come up even if I am not typing the exact same term. This may happen. It will just like give me an associated term. And notice how when you click on the actual header, it will break down the term definition, the different entry terms that have been used or are associated to the term. And then each one of these headings, it's going to be hierarchically presented. It's presented in a tree way so that each one of the terms is housed under a larger term. And this, it's going to be so helpful because it will give you associated ideas, related terms, terms that are more specific to the one that you're searching for, but that you can add to your search. So maybe you are going to initially look for the microbiota, but then identify that there is the gastrointestinal microbiome, which is more specific. So just keep that in mind. And once you're ready, you can just add this term to the search by adding it to the search builder. So you can see here on my screen how it is already added. And if I search PubMed, it will actually search the mesh field. And the way the database knows is by the syntaxes. So if you see the quotation marks, double quotation marks, and the bracket for mesh, this is letting you know that that's the specific syntaxes for this search to work within this field in this database, and not necessarily other databases. But we're going to talk about that a little bit more later. So that's how you can see that here. And if we go back to the screen where we had like all the different terms, you can see where in CINAHL you are going to have your control vocabularies in a different location. Same with Ovid Medline, as I was mentioning. So for Embase, you will have to click on the M3 link and explore within. Take each one of those as a specific reference source that it will help you identify the correct terms for you to use within that platform. Okay. The next thing that you are always going to need is a clear breakdown of the terms that you're using for each one of your concepts. So what you see here is the first concept, which is the one that we just searched for, which is gut microbiome. You're going to have all the different keywords in the natural language that you can think of. And you are going to have them listed and combined with OR, because for you, you want the database to retrieve it from anywhere in the record, say the fields that you're going to be searching within, but using that natural language. Then each one of the columns represents each one of the specific databases that you have chosen to make a very comprehensive, thorough search. And in this case, it's CINAHL, M3, and MESH. So as you notice, each one of them has its own syntaxes, the MH or the /exp for M3, which is like breaking down of any other term contained under Embase, under that specific term, and same with MESH terms for gastrointestinal microbiome. One little thing that is important to keep in mind is that once you have identified the control vocabulary term, it is always a smart idea to include that within the natural language field, because you don't want a good article to escape your huge net of recovering articles because it's not searching the right field. So if gut microbiota is the way CINAHL labels this type of term, you want to include gut microbiota within the keywords, within your natural language as well. You are not repeating anything, you are just enhancing the chances to retrieving more. Okay, so as you can see, we did that here. We included the terms in the field. And then once you have a clear map of all the terms we're going to use, we need to know how to combine them. Because we need to let the database know what term is important for us and which term is essential for us, for the database to bring us the result. So when you use and these are from the Boolean operators in math, and you probably all already are familiar with it in a way or another, but just keep in mind that when you're searching a database and you're using and, you're enhancing, you're like adding one more layer of specificity. You're being very like adding one more requirement and saying that you want both terms or whichever number of terms linked with an and to appear in the results. And that is why when you add and, you are being more specific, but you are also reducing the chances and narrowing your search. Your search is going to be more specific because you only want the group of articles that meet both conditions for the article to appear in the results. Similarly, or the opposite with or it's the broadest type of search. It's when you want either one or all another term to appear in the results as long as there is one of them. And when you use on, or you are actually combining several concepts, related keywords, this is where you are adding more chances for the articles to appear. And this is something that you do as a tool that you can measure if it's bringing more. So in general, or will always bring you more results. Then there is not, which is a Boolean operator that it is a little too extreme for the purpose of a systematic review. Because with not, you, whenever you are adding not and then a term, you, for example, you say not math exercises when you're searching for exercise, you are going to exclude a subsection of the articles. But because it is such a radical tool, and in a systematic review, you want to include as much as possible and maybe manually extract the ones that you don't want. That's why we in general don't recommend the use of not in this type of searches. Okay, so then here we are back to that scary search that Ramses showed us initially, where we have the breakdown from one specific database. This is from Embase. And each one of these groups, of these lines, represents a concept. So you have your initial concepts, but now they are all encompassing the different control vocabulary and natural language terms all together, all applying the syntaxes, the quotations, the single quotations, the slashes, the EXPs, and all the different terminologies that let the database know where do I want the database to explore for those terms. So the next slide will kind of show a little bit more in a more clear manner. You can see concept 1 and then the control vocabulary with the /exp in blue, and then all the natural language terms in green, and the fields where it's being searched for, which is the title, abstract, and the author keywords. All right, so each one of them is mega comprehensive. Each one of them is very, very detailed. But then in number 5, we are asking the database to combine the 4 prior ones and using AND. And this is your final tool to exclude anything that doesn't include one of the prior. And of course, your search number 5, if you are definitive search, the one that is going to exclude a lot of the priors, because you want each and every condition, either one from 1, 2, and 3, and 4 to appear so that you get results. So number 5, and when you hit search there, you're going to have a lot less results, but they are going to be way more on target. So now that we saw that very detail from Embase, let's see how that translates into other databases. So each one of them looks different, but at the same time, you have to be very accurate in the way we convert the terms. And notice how CNOL calls the term in a different terminology, how the syntax is different, and how the fields where it's going to search for the articles on that topic vary too. So just keep in mind that translating your search, it's a process that you have to be very careful. You need an extra set of eyes always to verify that things are accurate. And this is also the moment when your search skills are going to get to the next level, because you are going to understand that the search power goes across each one of the databases in its own unique way. It's its own unique product, and at the same time, you need to make sure that the search is exactly the same in each one of them. Back to Embase, this is where you can see from the search history and all the searches that you have been running, and you can combine them and creating that mega search one step each time. So number 1, it's that combination of control vocabulary for diet, but then number 2, it's more for the keywords or the natural language, whereas in 3, you're combining 1 and 2. It is a very specific Embase type of search, and not everybody is a fan of it, but it's good that you see how it works and that you consider that at some point you may apply it, and it's going to definitely increase your chances to finding what you're looking for. Just take a look at number 13, which is the top search, the final search where you combine all the prior, and you take a look at the right column, a smaller number of results, because of course this is the search that we are combining everything with and where we are saying that we only want all the prior criteria. Finally, once you have a definite list of results, those 775 articles, say that you want to do something with them. Now that you have the list of results that you definitely want to take a closer look at through your screening process, it's where you need to export your results. And the way you export the results is typically through an RIS file, which is the type of file that the other programs, the other softwares that you're going to use are going to be able to import easily. So take a look at the databases, look for the export option, and always look at the way to export it as an RIS file. This is going to be downloaded to your downloads folder, and then you can import it back into Zotero, EndNote. If you're using a citation manager, Using a citation manager at this point can be useful if you want to take a closer look at each one of the records, fix things, and be able to export these as a list of resources in a specific citation style, and also to deduplicate. But if you send it directly into Covidence, if you import it into Covidence, which we have available here at FIU for free, it's something that you can also use the Covidence deduplication tool to make sure that all those results that you got mixed from other databases are out, and you just have a total list of articles to go through. All right, so that it will be the way to navigate the control vocabularies, and I'm going to go back to Ramses for him to take it from here. And you're muted.
Let me just share my screen, and then we're going to the screening process, correct? All right, so from then on, once you have exported all your sources, then you'll go into the screening process. So all results, for the screening process, in order to avoid bias, all results should be reviewed by at least two people independently of each other, and this helps to minimize bias. So a third person of the team can serve as a tiebreaker if there's any disagreements about which which article should move further up into the screening process, and the reviewers are evaluating whether the study meets the pre-specified inclusion criteria, which was decided way back. Now we're talking like, I don't know, 4 months ago during the protocol. So the step one into the screening process is to do a screen by title and abstract. So you examines all the titles and abstracts for search results, and if the study meets that inclusion criteria, then it goes on to the next round, which is the full text screening. If the study does not meet the criteria, then it is simply excluded, and then of course always document the reason. Now, step two now becomes the full text review. So you review the full text for potentially relevant studies. This should be, once again, independently reviewed by at least two members, and you make the final conclusion, and you always keep a third team member for, in case there needs to be a tiebreaker. And for any results that get excluded, you always document the reasons. Now, for this process, we do have software called Covidence, which you have access to through our library, through the FIU library. And Covidence is really a very handy software for this process. So just kind of take you through a couple of different screenshots just to show you what it looks like. For example, here, this particular review is still in the title and abstract screening. You have all of your articles that you have uploaded from once you're done with your search. And what happens is, once you go into the title and abstract screening, you get the title and just the abstract of each one of those articles. You get a look at it, and then you could just simply click no, maybe, yes. Now, each one of the reviewers, let's say just two reviewers, even if you guys are sharing the same application, the same software, you'll be reviewing this at different times in your own computer. So each one of you, to avoid bias, will be doing this independently, of course, with a third person as a tiebreaker. You can also add your inclusion and exclusion criteria. So any reasons why you thought I shouldn't make it past the stage. And as you can see here, you can resolve conflicts. You're waiting other reviewers. So it really makes it very easy. If both reviewers agree that it should go on, then it takes you automatically to the full text screening. And here you could just simply click on the DOI and access the full text for your article. Once again, all you have to do is click include or exclude. It does have enough space there to give you an exclusion criteria. And once you do that, it actually takes you directly to, or it actually builds as you're doing it, it automatically creates the Prisma flowchart that you need to turn in actually with your article, and it gives you all of the the different reasons for inclusion and exclusion criteria. It automatically populates how many duplicates were removed, how many studies were imported for screening, how many studies were screened. So it does this automatically. So it really, really comes in handy. So how do you document all of this? In your public sample here, you can see this from an actual systematic review. You just essentially have a little space there for in your methodology for the data screen and extraction. So as you can see, the titles and abstracts are screened by AD and SG, so they did use 2 authors, and all decisions and discrepancies were made through discussion by at least 2 of the authors. So this is how they got around the bias. And then in the published example, they also included the Prisma chart, which, like, as I was saying, Covidence does that automatically for you. But, it does have the records identified, records screened, full text studies, that were assessed, studies included in the review, and very importantly, the reasons why the studies were, rejected or excluded. It also has the total number of records excluded after screening and the title. So everything has to be very, methodically. And now we move on to the extracting data step, and now we bring it back to Daisy.
Okay, can you see the slides? Yeah, Joanna? Okay, great. All right, so after you have done all of your screening and you decided which studies have met your criteria, it's time to extract the data from each of those studies, okay? So you have to collect data from those studies. It has to be the same data across the board. And again, this is something that you decide in advance in the protocol, what data you should be extracting from those studies. So you can use a spreadsheet or a form, right, that you fill out for each of those included studies to help you collect information. And we're going to see an example of that in just a second. So items that you might consider for data collection could be the identification information for the study, so the citation info, anything that confirms the eligibility for the study design, who were the participants, the setting, the intervention that they looked at in the study, the comparison if it's applicable, what were the outcomes that they measured, and then what were the results from each of those studies. Covidence, in addition to screening, also helps with data extraction as well. So once you get to that point, there are like options to create a form within Covidence, and then each full text gives the person who is doing the extraction an option to look at the full text and then extract the data. And everyone that's working on the project will be having access to the exact same form. So Covidence does help streamline that. So here's that published example again. So they tell us in their methods that they used the Joanna Briggs Institute, or JBI, qualitative data extraction tool. So it's basically a form that they applied to all the included studies. So this is what it looks like. So for each study, they filled out this form. The person who reviewed it, the journal title that this article is published in, what was the methodology, the method, the phenomenon of interest, the setting, etc. All of these things are filled out for each and every single one of those studies. And then the concluding deliverable is this table where they have collected all of the data for all of the studies using that form, right? And the form was used for every single one of these.
Daisy? Did Daisy freeze?
It looks like Daisy
Oh,
froze.
no.
All right. Let's give her a moment, maybe.
Yeah, let's give her a moment. Okay, so she'll be back, I'm sure. Let me, you know what? We could probably just move on a little bit more because we're getting kind of to the end of the presentation
Right.
stuff. I can do a couple of slides while
Let's do that. Let's do
yeah,
that so
while
that
Daisy
she's
comes
back. When
back.
she's back, things are already.
Sure. Okay, so we're talking about the quality of included studies. So we do this to run, to avoid the risk as bias, and, for quality assessment and critical appraisal. This helps to establish transparency of evidence synthesis resources. The goals of this assessment is to identify and report biases for each one of the included studies. So quality assessment of any study is likely to consider the following: appropriateness of the study designed to the research objective, risk of bias. Other issues would be choice of outcome measure, statistical issues, quality of reporting, quality of intervention, and generosability. So, what tools can we use? Please, you could always refer to the handout for links. Only includes a select few, but there are more. And it all depends on the study design that you include while being assessed. A lot of times they're just simply like questionnaires. Sometimes they might be a little more complex, but really they really guide you. This quality assessment tools really help to kind of just guide you through assessing the quality of your article. So, for example, in this Polish example, when they talk about the quality appraisal and their methodology, so they included studies were critically appraised for methodological quality using the standard, JBI critical appraisal checklist. See, and for qualitative research. In this case, it's just a checklist that you go through. Now,
We have
just
Oh,
Daisy back, by the
I'm
way.
back.
hi, Daisy, we're back.
Hi, sorry.
Okay, no problem.
Yeah, do you want to finish this out, this
No,
last
no,
part?
no. Go ahead. I am at the published. I'm at the
Oh, gotcha.
JBI critical list. Let me
Yep,
stop
okay.
sharing.
Sorry about that. Okay, share.
You're fine, no worries. Ramses
Oh, yeah, no.
put in awesome.
Okay.
Willingly.
Perfect. So, okay, yeah, as Ramses was saying, the quality appraisal checklist is basically a form. And again, just like the data extraction form, this gets applied to every single included study. And it's basically asking how well they did the study, how well they reported the study, as far as bias is concerned, and all these different types of bias are addressed. And again, depending on the study type that you're looking at, that's the checklist you will use. So if you're doing randomized control trials, you're going to use a list that looks at RCTs. If you're doing a more qualitative study, then you're going to look for checklists that's better for that. So on the handout, there are links to some of those, but there are many more available out there, depending on what you're doing. So then here, this is a summary of the published example. After they went through all their included studies, they give us a summary of how well all the studies did, right? So if we look at this first question here, is there congruity between the stated philosophical perspective and the research methodology? It's telling us that 25 of the studies said yes, 1 no, and 4 of them were unclear. So this gives you a picture of how well the studies did as far as their methodology. So once you've extracted the data, you have assessed the quality. Now you got to put it all together, right? So to summarize this, it would be a descriptive summary of any of those included studies. So you do want to have that table that describes those characteristics as well as how well they did on the quality appraisal. And then every systematic review is going to have a narrative synthesis, right? which you're analyzing the relationships between and within and between those studies, and then an overall assessment of the evidence altogether. And then you have the quantitative synthesis. So this is, again, going back to the beginning, a meta-analysis. If the studies are like enough to each other, then they can be combined statistically, and you can do a quantitative synthesis in addition to the narrative synthesis. So here's that published example again. So they were able to do some type of meta-synthesis. They talk about the different categories that they used to categorize the different studies that they included. So you can see here that they have synthesized them into the different categories. So that's kind of what you're trying to do, because ultimately you're trying to put this puzzle together and letting people know, okay, what are the studies actually saying? So this might look a little bit different from discipline to discipline. Even in scoping reviews, this might be more like this. You might see this a lot more where you're kind of charting all the different studies and categorizing them. So this particular published example, that's what they did. They synthesized the findings into these broad categories. So once you've done all of that, right, then you have to write up everything that you did. And hopefully you have a really great protocol and you have kept really good notes and you have, managed your data really well, so that you can write up your manuscript. So Prisma does have that reporting guidance, like we mentioned, with the checklist that helps you know, okay, what is it that we need to report, right? If you're submitting to a journal, make sure to verify that they do accept systematic reviews and what their specific requirements are beyond just, word count and things like that. Do they require Prisma checklists? Do they require for the protocol to be registered? So here is a nice little kind of breakdown of what you should have in that manuscript, right? You have an executive summary or structured abstract in the main text. It'll break down, like, for the methods, that how do you identify the studies? How did you select them? How did you extract the data? What did you use to do a quality assessment? How did you synthesize it, right? And hopefully the real world example that we've shown has kind of shown you what to expect for each of these parts in the manuscript. So here's that published example again, and we did look at several parts of this, but this would be your final report, right? And hopefully that it is published if that's the goal for you. Now, we did talk about study quality for the individual studies, but I do want to mention that even systematic reviews should be assessed for quality too. And on that handout, we do have links to different checklists to check if that systematic review was done properly, right? So just because a systematic review is published, it doesn't necessarily mean that it receives a gold star. Just like any other study type, systematic reviews should be assessed for quality as well. So on that handout, I think it's at the very end, there are different checklists to help you identify or evaluate the quality of systematic reviews. So here's just one example of those. This is a Robust tool. I think this is from Cochrane. So it'll ask questions just like the other ones, like, did the review adhere to the predefined objectives and eligibility criteria, right? So did the review adhere to a protocol? It has a whole question about the search. Did the search include an appropriate range of databases, right? Was it comprehensive enough? Or the terms and structure of the search strategy likely to retrieve as many eligible studies, right? So each part of the systematic review, you're kind of evaluating for quality. Basically, the entire process we've talked about today. So some takeaways, recap as we conclude here. Systematic reviews are research studies, right? It goes beyond a literature review. Their goal is to identify all the studies that have answered the same specific research question and combining them, synthesizing them, right? Systematic reviews are one of the highest levels of evidence, so it's important to practitioners, to decision makers, and public health. It's just one of many different types of evidence syntheses. There are other types of projects that you can do if a systematic review is not the right fit. It is a long-term project that requires time and a team. Make sure that you have that protocol or that plan before you begin working on the systematic review. There are several guidelines and standards, again, linked out on that handout to help you in knowing how to conduct these and then ultimately how to report them so that they're reproducible and transparent. And then to end off, we just have this Padlet. If you have a couple minutes here, I know we have 3 minutes left or so. If you have any questions, I see that there's some stuff in the chat here. but let us know, 3 things you learned, 2 things you want to learn more about, question you still have, as this will help us plan future sessions. So I'll put the link in the chat. There's a QR code there as well. And let's see what questions we have here. Okay, I see Joanna. Okay, on the data synthesis step, yep. Yeah, and I would say that I would say, as far as the question, just to add on to what Joanna said, that if there are bad studies, I think that if they met the inclusion criteria, I still think that they can make it to that phase. But then when you're doing the quality assessment, then you would indicate that that study was, not good for whatever those reasons were, based on the checklist that you've picked. So if you are doing randomized control trials and the tool that you use to evaluate that study, and let's say it did poorly on all the things, I would still report that, so that it's clear, because ultimately you're trying to say, okay, these are all the studies on this particular question, and this is the quality of them. So I would still report it instead of excluding it, so that people know what the quality of the study is, because that's ultimately part of the question. It's you're trying to answer what the question that these systematic reviews are asking, but you're also letting people know what is the strength of the evidence. And if the evidence is not that strong because that study is out there, then I think people should still know that. Hopefully that makes sense. Yes, thank you for the question. Yeah. All right. So we do have our contact information here. You're not alone. We know that there's a lot, and I saw in the chat of asking for different, like if there's webinars for these different parts, and definitely that's something that we have talked about doing, because it is very overwhelming. It's a lot of pieces to these types of projects, but you're not alone. We will help at least point you in the right direction. As far as the search, we can definitely provide assistance there and guidance. But yes, please, if you have any recommendations for sessions you would like, we could definitely look into putting those together. All right. Any other questions before we close out the session? And I'll briefly go into the Padlet in case it was filled out. Maybe not. Okay. So yeah, thank you so much for joining us. Yes, thank you. We appreciate that. And we look forward to seeing you in the next one, hopefully. Thank you, everybody.
Thank you. Bye.
Bye.
Thank you.
You're welcome.